This information is to guide Afghan women in regards to their health and how to navigate the healthcare system in the United States. Women's health refers to services only needed by women, such as regular female checkups, screenings, and pregnancy care. Women's care is mostly provided by gynecologists, obstetricians, nurse practitioners, and midwives. Gynecologists and nurse practitioners help keep your reproductive organs healthy and treat problems. Obstetricians and midwives assist with pregnancy and childbirth. You need to get women's care regularly. There are 3 common women's health screening tests that include mammography, pap smear, and bone densitometry. Mammography looks for breast cancer. Pap smear looks for cervical cancer. Bone densitometry checks to see if your bones are getting too thin and may break. If you are severely sick and need an emergency care, go to the nearest hospital emergency room or call 911 for an ambulance. But if your concern is not immediately life-threatening, you should not use an emergency system and visit your primary care physician or local urgent care instead. Before you visit a doctor's office, an appointment needs to be scheduled first. In many parts of the U.S., you just can't walk into the doctor's office and expect to be treated. Depending on the type of appointment, you may have to wait for days, weeks, or months. Urgent care facilities are walk-in clinics, but there may be a short wait. You may need to fill out some forms. Medical forms are an important part of your patient records. Your doctor is your partner in healthcare. Therefore, ask questions about anything that concerns you. Tell your doctor everything he or she needs to know about your health. You can go to the doctor's office or clinic alone or with one other person who can make decisions for you when needed. Doctors, nurses, and all people in a clinic or hospital will not be sharing your health information with anyone without your permission. No family member can stop you from the care you want. In the U.S., most women get regular checkups during their pregnancy, called prenatal care. In prenatal care, the doctor will monitor the health of the women and fetus. In the U.S., it is most common for women to give birth in the hospital. You don't have to be seen by a male doctor if you don't want to. Doctors recommend that infants be exclusively breastfed for about the first 6 months, and then continuing breastfeeding while introducing appropriate complementary food until the child is 12 months old or older. For moms who can't breastfeed or who decide not to, infant formula is a healthy alternative. In the U.S., it is important for babies to receive vaccinations to protect them from diseases and illnesses, especially when they are under 1 year of age. Your doctor or clinic should give you a list of the shots. Schools might require proof of vaccinations for your child's admission. If you don't have insurance to pay for your services, there are programs in the U.S. that may help. Ask your case manager or social worker to help you get enrolled in those programs. You might have brought some traditional herbs and materials with you and used them for yourself or children. It is important to tell your doctor about them if you are using them. Some traditional herbs may be harmful. People in your culture may see mental illness as weakness. They may not talk about mental health or may hide it. In the U.S., mental health is seen as being connected to physical health. Just as we go to a doctor to talk about our physical health, it is also important to talk about and receive treatment for our mental health if needed. If you have an anxiety and it is affecting your ability to function, or you have a low mood lasting longer than 2 weeks, it's a good idea to see your doctor for advice and support. Getting enough rest, exercising, eating healthy meals, and reducing stress will all help you maintain your mental well-being during pregnancy.